It is truly an honor to stand before you. Thank you to the Schwartz Center and its generous donors for making this night celebrating compassion in healthcare possible. I want to congratulate my fellow nominees. I think I can speak for each of us when I say that there is no recognition that could be more meaningful to each of us than the recognition that comes from this center. What Ken Schwartz established just before his death is a testament to his vision and truly the insight that comes from life-threatening illness. His awareness that it was compassion and connectedness that made suffering bearable laid the foundation for the amazing work being done by each of the nominees tonight. Like every caregiver, I have a unique perspective when it comes to compassion, and as you heard, I have the benefit of a very different perspective. In 2008, I had a tumor in my liver rupture, and I effectively bled to death in my own hospital. I lost my entire blood volume into my abdomen, triggering what's known in trauma as the triad of death. It's a kind of suicidal spiral of the blood where it's too cold and too acidic to clot. I would receive over 26 units of blood products that night, packed cells, platelets, cryo, and fresh frozen plasma. I would go into multi-system organ failure. My liver and kidneys would shut down. I would be placed on a ventilator. I would have a stroke. I suffered complete hemodynamic collapse. And the baby I was pregnant with would not survive. But I did, through the incredible grace and skill of the medical professionals who cared for me. My recovery involved 5 major surgeries, including a right hepatectomy, a surgery to remove the right half of my liver. I had to relearn how to walk, speak, and do many other things that I had taken for granted. But in the process, as a patient, I learned things about us, physicians, and other healthcare providers that I may not have wanted to learn. I learned that though we do so many difficult things so perfectly right, we often fail our patients in the smallest ways. Though I survived what I truly believed was an unsurvivable event, I was left scarred by deficits in communication, uncoordinated care, and occasionally a complete absence of empathy. And I recognized myself in every failure. As you can imagine, my experience changed me. It changed my vision for what I wanted our organization to be, for the values that I wanted it to embody. I wanted the value of empathic, coordinated care to spread throughout our organization. I shared my story. I wanted system leaders and really every employee to know that every patient matters. Everything matters. Every person, every time. The Cleveland Clinic, which is home to one of my fellow nominees, Dr. Rosenthal, has a fabulous tradition. It's called a failure bow. When someone makes a mistake, when something goes wrong, the person stands and they say, "This happened. I made a mistake." And they bow. And their team applauds them. And it's the most beautiful thing because it's something that's so absent from our culture, that transparency and vulnerability and accountability. It defines the amazing individuals who are being recognized tonight. In some ways, I feel that medicine has to take that failure bow to say, we had it wrong. We were focused so much on the science, we let go of some of the things that matter. Each of the nominees tonight is exceptional in their approach, in their compassion, in their understanding of the need to generously listen. What we need is for all of medicine to be all of those things all of the time. We got away from that a little bit. The knowledge that the patient holds as much of the knowledge as we do, that knowledge is bidirectional, that we can uncover so much more of that than we can if we stay in the clinical realm with generous questions, that to listen generously means connecting and witnessing and asking those generous questions. This community that Ken established gives me so much hope that we're finding our truth again. And that if we find it, we can also find resilience and joy in work and community. And really, if we find that, what more could we ask for? Thank you.